Live from the Business RadioX studio inside Renaissance Bank, the bank that specializes in understanding you. It's time for North Fulton Business Radio.
And hello again, everyone. Welcome to another edition of North Fulton Business Radio. I'm John Ray, and we are broadcasting, folks, as we usually are, from inside Renaissance Bank in beautiful Alpharetta. And if you're looking for a bank that is not going to tattoo you with that mega bank experience, you know what I'm talking about if you're at one of those big monster banks. Give Renaissance Bank a try. Now, here's the deal. I've worked with Renaissance with a number of my clients, and here's what I have found. They are big enough to handle pretty much any need you can throw at them, but they're small enough to do it in a personal way with real people answering the phone. So go to renaissancebank.com and find one of their local offices and give them a call. And I think you'll be glad you did. Renaissance Bank, understanding you, member FDIC. And now I want to welcome Terrence Hight Jr. Terrence is with Hight Health. Terrence, welcome.
Thank you, John. I'm glad to be here.
Yeah, I'm glad you're here. Let's talk about Hight Health and how you're serving folks out there.
Yeah, absolutely. So again, Terrence Hight Jr. Been in the healthcare space my entire career. So I started off as a registrar in an actual hospital. I worked in outpatient in the emergency room. And that's when I started to really develop a true passion for healthcare and helping people. So over the years, had, a series of different businesses. I like to say Hight Health is the third iteration of what we've been trying to solve since I was in grad school, which is connecting people to care. And we finally been able to do that. So
wow,
about being here.
That's terrific. Yeah. That's terrific. Well, let's talk a little bit about that journey.
Definitely.
What you said healthcare's been your career,
right? Yeah.
So why healthcare?
Yeah. So
why are you so passionate?
Growing up, it was always a doctor or a lawyer. That was what my family said, and so that was the only route I went. And what happened was I realized when I get to undergrad, I didn't really want to do that. And it kind of opened my mind. College did, and showed me all the different opportunities out there. So after trying creating a music business, and I was doing a 9-to-5 as working in healthcare, I realized, hey, there's a lot of disparities here. There's a lot of issues, a lot of problems, a lot of things that can be fixed. So in grad school, just ended up pitching that idea to my team, and we created a business plan for a business called Connected Care. Did that for about 2 years, and then that pretty much just started the journey as to where I am now. So,
yeah, what? That's one thing I think we've got. Is it fair to say we've got diverse opinions in this country?
Right. Yes.
But I think one thing everybody can agree on is the healthcare system is extremely complex. Yes. And I think you might in a lot of ways say broken, right?
Absolutely. That was one of my talking points back then was healthcare is broken. That's how I started the pitch competition.
Okay.
And it is. Absolutely.
Yeah. So you're trying to take a bite out of that and make that process a little bit easier.
Right.
Along the way.
Yep.
So it's really the I guess the business and the access part of it for you as opposed to delivering care.
Exactly.
Yeah.
We try to be that connector in the middle. And that's what the first company was, Connected Care. So that was our goal, is how can we be that intermediary, because we understand both the healthcare side and the other side. So that's really what we do now, and really successful at is being that connector between the businesses and the disparities.
Got it. What is the issue? Well, I guess let's before we get into that, let's talk a little bit about, you mentioned this is your third iteration.
Right. So
what is Hight Health all about that is kind of the new, improved, and next step along your journey?
Right.
Why was it so important that you start Hight Health?
Yeah. So the first version was Connected Care, which was a referral management software. We tried to do that, go into the technology space, and at the time, I think it was just a matter of not having the knowledge and expertise or resources to actually make it happen. I went into the consulting space with United Health Group and Optum 360, so I actually learned about healthcare from the payer side, which changed my entire perspective, and then actually went into, I was all out in the West Coast, California, New Mexico, all these different places, delivering healthcare technology solutions. So moved into the business and brand healthcare, which was more so working specifically with physicians, but we realized we still weren't able to close those gaps, because then we had to figure out, you can't control physicians. So, how do we get done what we want to get done. So this third time was like, okay, we'll just do it on our own. So let's create health fairs. And that's what we did. We started with our first health fair in Forest Park, Georgia, back in July of 2021. And we brought, all different types of healthcare providers there. What we did was we went a step further and we said, let's add a data component to it. So let's actually do surveys and social determinants of health surveys, which we can talk about later, and understand the true problems that the community is actually saying. And then now we can go to the powers that be of these bigger organizations with the budgets and to pour into these communities and say, hey, this is what's needed in this community. Right. So that's really how we got here into this point.
Yeah, that makes a lot of sense because not every community is the same, and certainly an underserved community.
Right, absolutely. And that's what we realized. We've been as far south as down in Clayton County, where a lot of our events are. We've been up here in Alpharetta, and each community demands something different. So that's part of what we look at is how can we uniquely and strategically design events and programs that can address the different health needs in each specific area.
Got it. And so, why a health fair? I mean, why that particular venue to connect with the community?
Right. So the main thing, when we looked at all the different disparities, we saw the access to care. So people having the ability to actually connect with it. And, we can get these mobile buses and we do have them at our events, but we didn't really feel that would truly connect the way we needed it to. Also, too, we looked at a broader perspective at social determinants of health. So what are all the different factors that impact health? Employment, the environment, access to education, job resources. And that's when we said, okay, we can address social determinants of health, which are all the factors that impact people's health through a health fair. So all of our health fairs have employment-related resources there, environmental-related, food-related, and healthcare-related resources.
Yeah. So let's talk about the issue of trust.
Yes.
In the underserved communities.
Absolutely.
When it comes to healthcare and access to healthcare. Yeah. Let's talk about that connection.
Yeah, definitely. And that's one of the things that a lot of our partners really depend on us and, for is developing that trust, because there are, a lot of, I'm not even sure really how to phrase it, but again, the trust is not necessarily there sometimes with a lot of the bigger organizations and in underserved communities. And, sometimes the underserved community may not necessarily know what's going on the side of a corporation, which is why a corporation had to do what it had to do with healthcare. And they may think, it's something that it's not, but, oftentimes it's the other way around. Maybe a corporation went in for one reason or another and maybe left for another reason. So, that's where we come in, is that middle ground, and say, okay, what's the big problem here? Is that we want to get people access to care and we want to make people ultimately healthy. That's our overall goal. So regardless of what's going on with this company or what this group thinks, we still are going to be here as that middle ground to develop that trust, be that trusted resource. Say we're going to get you connected to some type of resource, because there's plenty of resources out there. And that's how we feel.
Yeah. That makes a lot of sense. So again, the whole idea of a health fair, what does that look like? I mean, so your clients show up at this health fair. You've attracted them with something.
Right.
Because healthcare on its own might not be what draws everyone. Right. What do people find when they get there?
Right. And it really just depends again on the community. The churches have been great pillars in the communities that we partner with, finding different community organizations and saying, what do you want, in this community? We've led certain health fairs with, attaching the health fair onto a food pantry. So we have people, in order to get to the food, you have to go through the health fair. We've attached health fairs onto a job fair that we had for second chance felons with an organization back in Atlanta. So they were coming there looking for jobs, but at the same time, you can get your blood pressure checked. You can get your, see what your cholesterol is. So it's just a matter of us figuring out, outside of healthcare, because you're right, healthcare is not sexy, if you will. It's not a big draw, but we figure out again, what is it that these communities want? And then back to the data point, when people come into our health fairs, we ask them on the check-in survey, what is it that you want more of in your community?
Right.
So then the hope is the next year we go back, we bring more of those types of resources and then can continuously draw the community in.
Yeah, no, that makes a lot of sense. Now, you talked about the data you collect. during the health fair. Say more about that.
Yeah, absolutely. So again, it's social determinants of health focus. So we looked at different community engagement surveys that different, trusted healthcare system provide and said, okay, what are the questions that they're asking? How can we go a step further and understand, deeper, since we're boots on the ground, if you will, in the community. With that, we find out, do you have a primary care doctor? Are you vaccinated? Do you want to get vaccinated? Do you know about mental health? Do you want to be a part of, a virtual caregivers group? So there's multiple types of things that we can then ask and then really get to the core and the root of what each community wants. And then we work again with those bigger organizations who have those budgets and a social arm to say, hey, we want to go into these communities, but we don't truly know what they want and they may not trust us fully. And then we say, okay, well, this is what we can develop. It may be another health fair or health event, or it may be a chronic disease management program. But it just depends again on the community, and that's what we do with the data.
So I heard something there that is interesting. Mm-hmm. It sounds like you come into a community with the idea you're just not going to do one health fair. Right. You're going to do a series of health fairs that build on what you learn over time. Right.
And it's the health fairs is one. We do it, virtual or in-person events. So there's a lot of virtual workshops we do. And then there's a chronic disease management. So if we go into a community and realize, that we've checked blood pressures and 50% of the people have hypertension, well, hey, we have a blood pressure management program we can put in here. Mm-hmm. If we realize you don't have access to internet, well, we can, the affordable connectivity program, we can get you, a free tablet and free internet in your home.
Yeah.
So, yeah.
Got it. So what do you hope people walk away from when they go to a health fair? What are the outcomes that you're hoping that happen from that for them?
Yeah, no, that's a great question. I think the biggest thing that we look at is, is there one component of your health that you can walk away with and be more knowledgeable about? Maybe you didn't know that you had hypertension or high blood pressure, and you may need to go see a doctor. Mm-hmm. You may have not known about this job resource, employment resources out here to help you, get a job and take care of your family. So that's our biggest thing. If you can walk away, with one thing and just, one area of improvement that can at least get people's minds, wondering and thinking, we felt like we were successful.
Yeah, that's great work. Terrence Hight is with us, folks. Terrence Hight Jr. Dad, be proud.
Yeah. He's in healthcare too, so
he's he's beaming. Terrence is the founder and CEO of Hight Health. So, Terrence, let's talk about. You mentioned health disparities, health equity, and trying to reduce those disparities, right? Let's talk about the extent of the problem.
Right. And it's like kind of like you can throw a dart, at this point. One of the things we initially started off with was a very data-driven approach. I guess that's the MBA in me. Mm-hmm. But we looked at the areas that had the highest health disparities, and then we target those areas and said, we're going straight into these communities and we're going to bring the resources in. So one of the things we look at is having a strong relationship with primary care providers, because that's, basically the basis of what's called the healthcare continuum, right? And there's a lot of things from a preventative care perspective that can be taken care of if people just go to a primary care doctor. So, with the disparities related to access to primary care physicians, well, that's what we address when we come in with a health fair. Just figure out, how to get people connected to a primary care doctor, and then just kind of expand from there depending on what the community needs.
Got it. So you talk about measuring that inequity. Mm-hmm. How do you do that? I mean, what kind of data are you looking at to draw that conclusion in a particular neighborhood? Right.
And it's all types of data. So HRSA, different, CDC data.
Now, HRSA, what is that?
HRSA is a health Human Resources Services Administration.
Okay.
What it does, but they're just one of the organizations, but a lot of the organizations put information out there on, again, a food desert, for instance, or a primary care shortage area. Okay. And we look at that and say, okay, well, if this group, only the ratio of primary care doctors to residents, is off the charts in terms of in a negative way, then how can we connect primary care resources to this area? Maybe there's telehealth that's needed. And then from there, we realize, okay, wait, well, these people don't even have internet or access to internet. So we need to figure out how to get them some type of tablet and help them from that perspective. So it just really begins to build as we start off with one thing, which is, again, figuring out that access problem, just providing them access to the resources, and then from there, building and going on.
Yeah, I like that. That makes a lot of sense. Now, but do you look at like things like life expectancy or
I say, okay,
occurrence of particular disease or that kind of thing? Do you also look at that?
Absolutely. So life expectancy, that's one of the biggest, I guess, points that we talk about is, there's certain communities where literally from one zip code to the next on the other side of community, you're talking about a 20-year difference in life expectancy. Yeah. There's, certain areas with certain characteristics where, these people may have, higher hypertension or more mental health, problems. So those are the types of things that we look at. And then when we go in with our data and our survey, we can really validate that and say, okay, this is what we're seeing. This is what the community is saying on the ground. Now, how do we find the resource or the service to bring into this community?
So, okay. So you do these fairs, you find out what's needed, and you do that through actual customer measurement, if you will, right?
Right.
Through surveys and what have you. What happens next?
So that's when we go into either the virtual events where we're doing workshops. So it may be we collaborated with American Heart Association back in February with the Forest Park Ministers Association because we'd done so many health fairs in that area, and we figured out that hypertension was a big problem here. So we talked about stroke, hypertension, heart health. And that was a workshop. Then we followed that up with a chronic disease management program through a grant and a contract we got with the Department of Public Health to help people manage their high blood pressure, which is one of the big programs that we have running now. So that's the ultimate goal, is finding sustainable programs that we can bring into the communities and then expand those programs and ultimately get people healthy that way.
And do you find, I know the healthcare industry is huge and got a lot of different players of all sizes. How does the healthcare industry and the care providers respond to what you do? Are they responsive? Do they want to be involved with underserved communities?
Yeah, definitely. And the thing is, I think too, when we talk about underserved communities, it's broad, right? It can be low income. It can be, it can be a veteran community. It could be a 65 plus community. All those kind of fall into the category of that. So it just really just depends on the area we're going into. But what we found is, we've become a benefit, especially to a lot of the primary care providers and primary care resources. Like Morehouse School of Medicine has the HEAL Clinic. They were at our the second annual East Point Health Equity Summit, and they were doing cholesterol check, blood pressure checks, and all these, and they loved it. So things like that allow us to develop deeper and more ongoing relationships to address bigger problems at scale.
Yeah. Wow. Great work. So what are you looking for? Let's talk about what the kinds of connections and whatnot that you're looking for to help build your business.
Right. The biggest thing we're looking for now is just the relationships with the organizations that have that social impact arm. Because we again, putting on the MBA hat, and understanding how businesses operate, we understand that, obviously you want to make money, make profit if you're a for-profit organization. But at the same time, there's a social good arm that a lot of these organizations have. And I just don't think they necessarily are mobilized as best they can be sometimes. So we are that group, that conduit, and come in and say, we understand how you operate and we understand the communities. Let us help you with your social impact, specifically in the healthcare space.
Right. Yeah, that makes perfect sense. And do you find that, even for those companies that maybe don't have what they call a social impact arm, they still have a desire,
right? Yes,
to be involved in some way, right?
Absolutely. Because I think at the end of the day, John, we're dealing with humans, and I think people care, and I really do, and I just think it's just a matter of, from the business side, how do we get into the community? Where do we go? Because again, you can throw a dart and find a problem. So that's just kind of where we are. Is how do we get our voice out there? Partner with these bigger organizations, and then again address these issues at scale.
Well, it's real easy to throw money at something and throw resources at something, not just money, but resources at a community. But you want that to be sustainable.
Right.
So
Absolutely.
that's really what you're helping them
Yes.
get to is they can make decisions about the investments that are sustainable so that they will be there over the long haul, and that benefits them and the community.
Yeah, absolutely. And that's our perspective is going into communities, doing multiple things in communities and really staying engaged in the long term, saying we're here for the long term. You all may come in and out, but if we can develop a sustainable program, maybe you pass it to the next corporation for the next 5 to 10 years to support, and so on and so forth, until we can really, solve the issues and really address the disparities.
Wow. Great work. Terrence Hight Jr., folks, with Hight Health. He's the CEO of Hight Health. Terrence, this has been great. I mean, what great work you're doing.
Thank you.
Yeah. And, but before we let you go, we got to get to the most important question is how folks can get in touch.
Yeah, absolutely. So you can reach us at our website. It's my last name, HIGHT.health. So www.height.health. Or you can call our office directly at 404-614-0710.
Terrific. Terrence Hight, folks, with Hight Health. He's the founder and CEO of his company. Terrence, congratulations on the great work you're doing, and we're just delighted we could shine the light on that work. So keep it up.
Thanks so much, John. I appreciate the opportunity.
Yeah, thank you. Hey, folks, just a quick reminder. If you are having some health issues in your back office, and you know what I mean by that, your bookkeeping's a mess, or you've got all these to-dos, your to-do list is crazy long and you can't get to all of it. You've got administrative tasks that are driving you nuts, and you know you shouldn't be really working on those. You should be giving those to someone else. The team at Office Angels, they have got a whole team of angels that will fly in, get that work done for you, and they'll fly out. And they do it on an ongoing or as-needed basis, and they do fantastic work. I know this myself because they helped me with my business, and I couldn't run my business without them. So if you're shy, go to officeangels.us and check them out. But my suggestion is just give them a call, 678-528-0500. They are fantastic. Just tell them what your issue is, and they will craft a solution for you and get the right people for you and get you on the road to feeling less stressful about your business. And just a quick reminder, two reminders actually. I've got a book coming out later this year. It's called The Price and Value Journey: How to Raise Your Confidence, Your Value, and Your Pricing Using the Generosity Mindset Method. Go to pricevaluejourney.com to learn more. If you're a professional services provider struggling with business development and pricing issues, it may be a book that you might enjoy. But we would love to get your feedback on that as well. And speaking of feedback, you have done just enormous good for us and for our guests in supporting this show, and I'm so grateful to you, our audience, for that support. We're now at coming up on show number 700, which is hard for me to believe. After almost 7.5 years that we're at show number 700 for North Fulton Business Radio. And we've only gotten this far because of you. So thank you for your support. Thank you as you continue to share the show. You like us on social media and support us there, and we're just grateful that you continue to do that. So thank you for helping us live into our mission to be the voice of business in the North Fulton region. So for my guest, Terrence Hight Jr., I'm John Ray. Join us next time here on North Fulton Business Radio.